Hello and welcome to the International Society for Physical Activity and Health podcast. Today's podcast is one in a series of 9 podcasts on the 8 investments that work for physical activity. The 8 investments that work for physical activity are a call to action for everyone, everywhere, including professionals, academics, civil society and decision makers, to embed physical activity in national and subnational policies. It's time to get into our podcast for today with your host, Matthew Tepi Mclaughlin. Okay, we're here today with Dr. Karen Milton, President-elect of the ISPAH Society. How are you doing, Karen?
Yeah, I'm good, thanks, Tepi.
Good. So the investment that you led was healthcare. Could you tell us a little bit about that investment?
Yeah, sure. So I think healthcare is perhaps one of the most obvious best investments. When we're in a healthcare setting, we're usually thinking about some aspect of our health or how to improve our health. Also in a healthcare setting, we're often asked about our health-related behaviours, and particularly smoking, diet and alcohol consumption. But we're less frequently asked about physical activity.
Is that like when you go to the doctors?
Well, doctors in particular often ask about diet, smoking and alcohol, but hardly ever ask about physical activity, if at all. But I think there's scope beyond doctors as well.
Yeah, okay. Yeah. What is that? What's beyond kind of your GP? How does the healthcare setting, what other parts of the healthcare setting?
So when we talk about healthcare, people often initially think about GPs because they're usually our first port of call. But there's many people in healthcare setting that potentially have a role in promoting physical activity. That obviously includes doctors, but also nurses, healthcare assistants, dietitians, physiotherapists, occupational therapists. Let's also not forget the social care sector. The social care sector in many countries is large and expanding, and those working in social care also have access to a lot of people that could benefit from being more physically active.
So my next question then is why is this investment important to boost levels of physical activity?
I think there's a number of reasons why the healthcare setting is particularly important for boosting levels of physical activity. Firstly, many of us see our general practitioner at least once per year. And those people that have got chronic conditions who are a particularly important target group for physical activity promotion see a health professional even more frequently. So health professionals have access to a large proportion of the population. In addition, health professionals are generally well respected by the population. We trust what they say and we're likely to be influenced by what they tell us. And in fact, we know that 1 in 4 people say that they would be more physically active if they were advised by a GP or a nurse. Yeah. So there's huge potential there to promote physical activity in this setting.
Yeah, okay. So this investment is targeting those people and those GPs, those physios, those about trying to incorporate physical activity promotion into their practice.
Yeah, for sure. So these health professionals generally don't receive any education or training about physical activity. So they don't understand the health benefits of physical activity. They don't know how to assess patients on physical activity, what they should be advising their patients about physical activity. So they just don't do it. It doesn't really register with them that this is their role. I think many health professionals do see it as their role to ask about smoking, to ask about diet, to make referrals into smoking cessation services or diet advice, but they don't see physical activity as being part of their remit. And I think that's because it isn't on the curricula of medical courses or other health-related courses.
Yeah, and I'm sure there are isolated or, a small number of really large advocates in this setting that do it really well.
Yeah, I'd like to think that I'm one of them. I work in a medical school, so I've managed to get physical activity onto the medical curriculum at my university and also onto the curriculum of other health-related courses that we deliver. But there generally isn't a physical activity specialist or advocate working in these medical schools or on these health-related courses. So I think we really need to move beyond relying on individuals and work out how to change the education system so that physical activity is embedded in these curricula and we're not just reliant on individual advocates.
So that's the kind of way to get there, is it? Embedding it within teaching of these professions?
Yeah, I think so. And I think that there is scope to do that. I think, well, particularly medical courses, but other health-related courses, what gets taught is dictated by external organisations. So, for example, we have the General Medical Council that tells us what we need to teach on the medical programme. And the General Medical Council currently does encourage promotion of lifestyle behaviours, but they don't specifically state the words physical activity.
Right.
So health professionals are getting a sense that lifestyle behaviours is something that they need to be aware of, but still they think about the three other behaviours of diet, smoking and alcohol consumption. And I think until the words physical activity are explicitly stated, it's going to constantly get forgotten.
Yeah, okay. Okay, so what was some of the evidence discussed for this investment?
Well, there's strong evidence that promoting physical activity in the healthcare setting is both effective and cost effective. So we know that it works, and we also know that it's good value for money. And there's particularly strong evidence around providing brief advice to patients and also signposting or referring patients to physical activity opportunities within the community. So they're the things that we really try to promote in this investment. Brief advice and then sending people off so that they know what opportunities are available to them. But we know that 70% of doctors don't currently discuss physical activity with their patients. And the reasons given for this are a lack of training, lack of confidence, knowledge, and a lack of time. So we know that they're the four things we need to try and address if we want to encourage physical activity promotion within the healthcare setting.
Right, yeah. So how would this investment fit into the systems-based approach? Is that because it is that signposting thing you were talking about? It could signpost to, oh, active travel is a good mode, or the sport setting or something like that.
Yeah, exactly. I think that the healthcare setting is a kind of pivotal starting point for people to start thinking about physical activity. But like you say, there's an opportunity then to educate people about the scope of physical activity. We're not just talking about structured exercise. We're certainly not talking about going to the gym. There's opportunity to be physically active in everyday life through walking, cycling, playing sports. So I think the health professional really is the gateway into opening doors into opportunities.
Yeah, it's interesting because the way that Dr. Paul Kelly framed the public education and mass media is that kind of sits and connects them together, connects the investments together. And this one, at least in my head and the way we've been talking, is a possible starting point as well. Like, is a possible way to connect them all together as just another way, which is great. And it's how it all fits in, right? That's how it all connects together.
Yeah, for sure. I think one challenge in this space is the kind of structured opportunities within the community. So how does a GP know that there's a 5-a-side soccer league or that there's Zumba on a Wednesday? So, I mean, if there are specific activities that people are interested in, the GP may not actually know what's available in their community, but they obviously can promote things like active travel walking without really knowing the local context.
Yeah, fair enough. Yeah. Okay, and then so coming towards a close, but a rather big question, what are the key recommendations for policy, for practice and for research that come out of this investment?
Okay, let's take policy first. I think the policy one comes back to the curriculum. I think, well, we currently know that most health professionals don't receive any training on the topic whatsoever. So I think we need to change the medical curriculum and the curriculum for other health-related courses so that we are raising awareness of physical activity and its importance. We build knowledge and confidence among health professionals so that they're able to assess and advise their patients. So I think from a policy perspective, getting this into curricula is the key thing we really need to do.
Is that what happened for smoking and for diet? Did it get embedded within curriculum like this?
That's a good question. Diet is definitely well established on health-related courses at my own university, and I assume others. Smoking, I don't actually know how much is covered in the curriculum. I think there's just this now general awareness about how bad smoking is, that it's just on everybody's radar.
All right, so for practice and for research then?
Okay, in terms of practice, I think we need to make the process really clear and easy. I think it's important that we have some sort of standardized protocol so that we can say to health professionals, hey, this is what you should be doing and this is how to do it. And I also think that having a standardized protocol also makes sure that we're doing things consistently across the system as a whole. So it's not just ad hoc as to where you live, what sort of support you get for physical activity. The other thing in relation to practice, I think, is having the tools and resources available. So we want to understand how active our patients are, and then we want to have resources available to promote physical activity to them. And a frequently cited barrier to physical activity promotion in healthcare is a lack of time. But there's now resources available to support health professionals to promote physical activity within very short windows of time, like 60 seconds. So we need to make sure that these sorts of resources are widely available so that health professionals can see that this is a feasible thing to do, even when there's a very, very short amount of time in a consultation.
Yeah, sure.
Coming on to research, I think we know a lot about barriers to physical activity promotion in healthcare, but we know less about how to overcome those barriers. So what sorts of training work best, what assessment tools are easiest to use, how to keep health professionals informed about what opportunities exist in the local community. So I think we just need to move in a research context away from constantly asking about the barriers to physical activity promotion and trying to understand what are the best solutions.
Like an implementation science approach for it.
Yeah, exactly.
Yeah. Okay, so coming to a wrap up then, is there anything else you'd like to add?
I don't think so.
No?
I think that's covered the core ground. I think we need training, we need resources, we need obviously to increase awareness. I think that's where we start.
Great. Thanks for joining us today, Karen.
Thanks, Tepi.
Well, that brings us to the end of today's podcast. But if you haven't done so already, I'll encourage you to subscribe to your favourite podcast channel. The International Society for Physical Activity and Health podcast is available on all of the leading podcast channels, including Apple, Spotify, Google. If you've got an idea for a podcast, you can send that through to info@ispah.org. Thank you very much for listening, and we hope you can join us on our podcast again soon.